Hello, everyone. Let me make sure this is working good. Okay, so my name is Kendra Batie. I am a third semester medical student at MUA, and I'm here to do a Facebook Live with you all today. So I'm originally from Monroe, North Carolina. It's just outside of Charlotte, anyone where that is. From Monroe, North Carolina, and I got my undergrad from Campbell University in biology. So now I'm at MUA in medical school, and things are going pretty well. So some students have compiled a list of questions that they kind of have for us, and I just wanted to go over some of those questions and get any gray area out for anyone. Okay, so I guess we'll start with the first question now. So first question, did you look at other medical schools in the Caribbean, and if so, why did I choose MUA? So just like undergrad, you always look at other schools. You always look around, try to figure out what school will suit you best, correct? So, this is no different from medical school, even more so for medical school. So, of course, I looked at other schools, and I kind of filled out, what things I was looking for. And some of the things that kind of drew me to MUA was the fact that, it had small class sizes. That's one thing that always gets me. It was one of my major factors in choosing, my undergrad school as well as, my medical school, having a class size that is huge. Some of the medical schools have like 200-300 students in their entering class, and it gets to be overwhelming. And I guess for me, I wanted that one-on-one attention of the professors. Like I wanted to make sure that I can get in to see them when I needed to make sure that, if I had any questions, I could definitely get those answered in, a timely manner. And that's one thing about MUA, the class sizes are really small, and it gives you that intimacy that you need when you're in medical school. It's stressful, and especially if you don't understand something, it really helps to have a small class size. Therefore, you can interact well with your classmates as well as with your professors. So another deciding factor for choosing MUA was they have Title IV funding, which is amazing because, I'm from North Carolina, so I am American, and, having that financial burden kind of relieved for me was definitely a huge plus. So those are most of the reasons why I chose MUA. Not only that, it is on a Caribbean island and it's beautiful here. So for the next question, do you like the island of Nevis and do you feel it is safe? So Nevis is beautiful. Number one, it's got blue waters, greenery everywhere, flowers. It's kind of like, where I'm from. I'm from the country part of North Carolina, and, it has cows, sheep, goats, different farm animals everywhere, which is, it was an adjustment, but it was cool. It was the one place that I had to learn the difference between a sheep and a goat. The sheep don't look like normal sheep here, but, you'll see when you get here. But it's beautiful. It's nice to come outside and know that it's bright and sunny outside. It really lightens the mood. It makes you feel happy. One thing is going through winters and going through dreary days, it does not add, it does make things a little bit difficult when you're dealing with stressful situations, but it's nice to always be able to just go sit outside and enjoy the breeze, enjoy the sunshine. As far as, do I feel safe? I've never had an instance where I felt unsafe, on Nevis. There's security at school. Most of the time I just use them like if I need to a ride home or I just need to be walked to my car, they're there to help us with that. It's dark. Sometimes, we're leaving the library or the study rooms at 2-3 o'clock in the morning. So it's nice to have somebody there to walk with you and, kind of join you on your endeavors. So the next question we have is, what worried you the most about starting medical school and how did you conquer that fear? So it's medical school, and I think everyone's fear is basically, can I cut it? Can I do this? And that's a great question to ask. And it was one that I asked. It was one that I was very afraid of because, I had talked to many physicians and, talked to many students who were in clinical rotations and things like that. And they said, it's a lot of material. And now that I'm in medical school, it's a lot of material. And, since Med 1 and now I'm in Med 3, it's something that I've definitely conquered. The one thing that I needed help with was time management, as well as, retaining information. So my study skills and, how I was going to work on those things when I got here. I did read a book before I came, just showing me how to study and different ways that I can go about, retaining information and, things like that. So I did do that, as well as time management. You know, I had a professor, Dr. Dutta, he's here now, he's Med 1. We were all sitting in the anatomy lab, and I was just asking, you know, how am I supposed to study? Like, what should my schedule be? And he always harped on, you know, your study skills, like your schedule is everything. Your schedule is everything. So he took a napkin and he wrote out a whole schedule for me for the entire week. So it gave me Monday through Sunday. And I loved the schedule so much because it included a nap. So we're in school a lot. So it's nice to come home and be able to take that nap. He included, you know, time to call my family back home, times that I should eat, when I should prepare my lunch for the next day, you know, when I should, you know, take a 15-minute break or take a 10-minute break. You know, he included all of these different things in the schedule. And, you know, it really helped me, you know, manage my time well in Med 1. And, you know, since then, I know what I have to do. And it kind of, it's like, okay, you know, you're sleeping too much, or, you know, you're watching Netflix too much. So it kind of puts a halt on that, definitely. But, you know, it's something that I was definitely able to overcome. And there's plenty of people here that are willing to help you, upper meds, you know, your professors, especially your professors. You can talk to them about these different things. So my next question is, now that I've applied and I've started medical school, how do I feel? Who wouldn't feel amazing at this point? So this has always been a dream of mine, and it's something that's, you know, near and dear to my heart, you know, ever since I was a little girl, and, you know, going through, you know, my childhood and losing my grandfather. That was really the driving force of why I chose to be a physician. And now that I'm here, it's like, you know, I've conquered one hurdle, and then now it's just getting through medical school. But it feels amazing when they, you know, you have your white coat ceremony Med 1, and they come and put that white coat on you, and it has your name, and, you know, you just feel so official. And it's the best feeling I think I've ever felt in my life. You know, tears were rolling. It was a whole production, but, you know, it was an amazing feeling, more so than anything. Also, being in medical school, you don't really realize how much knowledge you're gaining by being here. And I think we all kind of had this epiphany the other day. We were in a class called Clinical Correlates, and we were reading a research article, and I was like, oh yeah, that's that receptor that did this, or, oh, the neurotransmitter that works on this, and, you know, all of these different things. And you're learning how all of these different, you know, receptors and chemicals are playing a role in your body. And we just all sat back and we're like, wow, from Med 1 to now, we didn't realize how much we really gained. And, you know, sitting in that class and in that moment, we realized how much we've learned and how much closer we are to being, you know, everything that we've always wanted to be. And again, that was really, you know, it was shocking to me. I was like, wow, I really learned a lot. So everyone knows that, you know, being in medical school is hard work, and, you know, you're going to have a lot of long nights. You're going to have a lot of long days. You're going to reach a point where you're tired, and, you know, you should be. You're learning a lot. You're really putting in a lot of work, but in the end, the hard work pays off. And, you know, Dr. Shivani earlier today, this is something that she told me. She's like, you know, you just need to think of yourself in the end. Think of yourself graduating. Think of yourself entering into your residency. Think of yourself as the first person who calls you Dr. Batie. You know, it's a good feeling. So that's something that you should definitely look forward to and keep that in mind as you're going through this process. So the next question we have is, what's your favorite place to eat on Nevis and why? So Nevis has a couple places to eat. I think one of my favorites is Yachtsman Grill. They have a really good meat lovers pizza, which is pretty good. And, you know, they have really good Parmesan cheese, and they have this olive oil that has like garlic infused in it. So it's like the whole, you know, Italian scene there when we go. And there's another, and that particular place is on the water. And so you're right in front of the beach. You can go out, stick your feet in the water. It's a lovely situation. And then there's also up in the mountains. So we have mountains too. So you can go up in the mountains, and you can actually go to a place called Golden Rock, and it's beautiful up there. You can see basically the islands around you even. And they have really good burgers there, and, you know, a couple different dishes that you can try, but they have a lot of greenery, a lot of, you know, waterfalls, and just a lot of flowers. And it's actually a really pretty place to take pictures if you like to take pictures, but, you know, that's up to you. And then we also have our cafeteria at the school, which is more accessible when you're in class, but, you know, they serve breakfast, lunch, and dinner for you. And, they have things such as Johnny cakes and chicken. And let me tell you about the Johnny cakes. The Johnny cakes are amazing. They are, they come on Friday. So you get fried chicken and Johnny cakes. And they always have really good rice. They always have, all these kind of things that you can eat. And, the cafeteria ladies, they come up to us and they check on us and they're like, are you sleeping, sweetie? You make sure you get some rest. And, you really learn to build a family with the people around you, even our professors and the students and different things like that. Like, they really they have an impact on your life and your day to day. So, even something, going to the cafeteria, that's something that can also uplift you, which is, great. So the next thing is, can you share your thoughts on the island life and living, specifically by housing and food? So yeah, I can definitely do that. So island life, like I said, it's kind of like the country here. So it's something that I'm used to. It's more of a slower pace of life, which is fine. Sometimes we need to kind of take a moment to breathe and relax and slow down a bit. So coming to Nevis, not only does it make you study, because it's the atmosphere here. You want to study, and it allots you the opportunity to study because everything is so beautiful around you, and there's so many places that you can go to just sit and read a lecture or do some cue cards or whatever the case may be. And again, you're building a family. The island it's pretty small, and you start to see a lot of the local people, and you're learning about their culture, you're learning about their history and different things like that. There's the Hamilton House. So Hamilton was born here, which is pretty interesting. So they have like a small museum here too as well, and it's pretty cool. And they have Carnival, which is always a blast in December. Look for it. And specifically, I guess, about my housing. Okay, so we're in my apartment now, and I love my landlady. Like, she's amazing. Like, if I have any issues, anything breaks, I message her on WhatsApp and I'm like, this isn't working. And she's like, okay, I'll get somebody over to check it out and I'll make sure it's taken care of. Like, I never really have to, worry about anything. She's really like a second mom while I'm here. She kind of keeps things together as far as my apartment. So that's one less stressful thing to worry about. And the food, the food is just like home. Like, if you really want, macaroni and cheese, you can get macaroni and cheese here. If you really want rice, they have chicken, they have steak, they have whatever you want. You can definitely find it here. Now, for those specialty things, like things that you find like that you can only get at home, those things you may have to bring on the plane with you. But for the most part, they have ice cream, they have milk, they have cereal, they have all the necessities that you will need to make sure you can fill your belly. So no worries on that. So the next thing is, what is your daily schedule of classes? So, excuse me, I'm sorry, I'm talking a mile a minute. So let's talk about Med 1 a bit. So Med 1 is pretty cool. I also have a question about the cadaver lab and the anatomy lab, so I'm going to include this in here too. So Med 1, you have histology as well as anatomy. It's great because, a lot of the times they really try to tie things in together with the subjects, which is nice. But, histology is really, really cool. I actually enjoyed histology a lot. You'll have Dr. Mamatha and Dr. Kacker in that, and they're both really amazing teachers. So you'll really enjoy that class. And you have anatomy, and anatomy is kind of like a handful of professors. But, anatomy is really cool because, it's like the foundation. Like, you first need to learn about the body first. So anatomy kind of leads you into that. So going through anatomy and anatomy lab, one thing that I really enjoyed the most about anatomy is the lab. A lot of schools are kind of steering away from actually using live cadavers, but that's one feature that MUA definitely has is cadavers. And it's awesome because you're really you are physically going to find the structure and you're learning about its function. You're learning about if it's damaged, what happens and things like that. And using the lab time, I cannot stress enough how important it is to use the lab time to really understand and correlate to what you're learning in class. I'm more of a visual person, and most people are very visual, and it kind of helps you to really understand that material and dedicate it to memory. So the anatomy lab is awesome. When you come, just make sure that you bring a pair of scrubs, scrubs that you can only wear in the anatomy lab, as well as a pair of gloves. Some people have latex allergies and things like that, or they just have their favorite gloves, or some gloves are irritating. So that's something that you want to bring to your own gloves. And Yeah, so in a pair of shoes that you're okay with, getting some juices on, not so much, but just in case. So that's your starter pack for Cadaver Lab. So then Med 2. So Med 2 deals with biochem as well as a class called IDR and genetics. Now within IDR, there's immuno as well as microbiology. Med 2 was a long class, or a long mid. I felt like it was really long for me. But I really enjoyed it because biochemistry teaches you like everything. It's like why you did everything. And before this, like I worked in a biochemistry lab, so it was really cool to me because some of the things, not a lot of things, were, taught in the class, and it kind of gave me a deeper understanding of that information that I worked 3 years in a lab, and half the stuff I didn't even know. But now that I've taken biochem, I'm pretty solid in what exactly was going on. So biochem was by far my favorite class. Micro is also fun. You'll meet Dr. Kumar. He's really funny. We always joke with Dr. Kumar. So he's an amazing professor. So you'll really, really enjoy his class. And he loves cracking jokes with you. And, he really makes you feel like, there's no dumb question. If you ever have a question, I was in his office all the time. So, just invade his lunch. He'll be fine. There's also, so genetics was pretty cool too. Dr. Pandey is an awesome professor also. He makes, learning genetics very easy. And it's just like, in the end, you're like, man, that was so easy to learn. So he's a great professor too. So you'll enjoy Med 1. Like I said, it's a long schedule, but for the most part, it's good. Now that we're entering Med 3, which is where I am now, I have neuro, behavior, which are a class together, as well as system and diseases, which consist of path, pharm, and physio. So again, you'll enjoy these classes too. It's a lot about the brain and what's going on, and clinical features that go along with it. And you really, when you get to this med, you really kind of understand why it's so important to really learn everything from Med 1 to Med 3, because it comes back. It's like a plague, just comes and haunts you all the time. So make sure you learn it. Make sure that you are really putting your best foot forward as far as learning. Make sure that you are taking it into consideration, because it's definitely important. All classes start at 8 o'clock, so we all come in together. We don't necessarily leave together, but between the meds, it kind of varies. So that's what Med 1, Med 2, and Med 3 looks like. It's a fun ride, so you really enjoy all of these classes. It's really setting the foundation for your higher learning when you really get into Systems Disease 1, System and Disease 2. So the next question that I have is, what is your relationship with your professors? Are your professors accessible to you and helpful if you don't understand something? So hands down, yes. I've never heard of a professor minding you coming in during your lunch break just to talk about concepts or to go over things that you don't know. So it's definitely something that, definitely helps us as students, because the relationship that we have with our professors are everything. You have to be comfortable enough to go up to your professor and ask a question. And, some people are weird about not understanding, but, you got to let that fear go. And definitely, if you don't understand something that day, you can go up during your break between classes and say, can you just explain this to me again? And they'll walk through the whole pathway with you, no problems. If you don't understand, no problems. Our relationships, they extend further than, just studies or whatever. They're there to support us. They're there to encourage us. So, Dr. Kumar, like there's been plenty of times where, Med 2 was traumatic. I had a lot of personal things going on at home, and I could go to Dr. Kumar and even Dr. Odutola. Like I've been in her office and I've, discussed some things that I'm stressing about, and, they give you ways to deal with the stress. They give you ways to deal with the situations, and it makes all the difference. Even today, talking to Dr. Shivani, like I'm like, I am just tired. And, under this makeup, there's raccoon eyes because, no sleep comes with medical school. And she's like, just think about the outcome. Just keep that in mind. Just, one day when that person, they come up to you and they say, hello, Dr. Batie, it's going to be an amazing feeling. And that's definitely something that I'm looking forward to. And that's one of the things that I definitely keep my eyes on whenever I'm whenever I'm having a hard day. But you'll never have a problem with, a professor being accessible to you. And again, that goes back to being a smaller school, having smaller classes, because they do help you when you need it. And not only that, even the Med Fives, like they just took a shelf today, and they're preparing for their comp. They've been going around to all the professors, just clearing things up that they learned in previous semesters. So definitely got a good staff here at MUA. So the next question I have is, how does MUA's curriculum professors prepare you for step 1? Is there a comp shelf exam before step 1? So you'll hear from Med 1 professors telling you that you need to go get your first aid book. You need to be reading it now. You need to be doing questions now. You need to be preparing yourself for comp. And this is all the way in Med 1. And you're thinking, I have a whole month and a whole year and like 8 months to even get to that point. But, the advice that they gave us Med 1 has definitely proven true. It has helped us to retain information by doing questions. It's helped us to, stay on top of previous work that we've gone over, and it really helps to prepare us ultimately for our comp exams and for our step 1 exam. So there is a comp and there is shelves as well. So we basically you will definitely have a shelf at least every semester. There will never be a time where you don't have a shelf exam. Med 1, we had one in histo and anatomy. Med 2, we had one in biochem. We had one in IDR, which is our micro and immuno class. And even though genetics wasn't necessarily a genetic shelf, genetics is incorporated into biochem, so you technically had that one too. And this semester being in Med 3, we'll have a neuro shelf and a behavioral shelf. And then Med 5, when we get to Med 5, we'll take our Path, Pharm, and Physio, which are the 3 Ps, which are probably the most heavily tested subjects on our step 1 exam. So you'll take those 3 before you sit for your comp exam, and that's something that kind of will help you make sure that you have mastered those three courses to make sure that you are prepared for your comp exam. And shelf should always be taken seriously. A lot of schools, they don't do shelf exams like for every class. And shelf is, for those of you who don't know shelf, like they are retired step 1 questions. So it really will tell you where you stand as far as, if you take step 1 right now, what would you score? So it helps you not only know where you stand, but it helps you to know where you need to work on, what you need to work on. So those are definitely important in your preparation for the step 1. So the next question is, do you enjoy the interactive learning sessions, and do you feel that they're beneficial for learning? So a lot of things that we do in our classes are actually interaction. We get to talk to each other. The professors kind of know that, we're there for quite a couple hours every day, and we're chomping at the bit to say something, and sometimes our 10-minute break isn't enough. So being able to discuss concepts with your fellow students and go over those kind of things are important to us, because it really lets you know if you really know the material. It's one thing being able to read it out of a book. It's another thing when you can actually recite it to someone, because if you can recite it from memory, then you really know it. And that's one thing that most of the professors stress, especially for pathology. Dr. Jeevan, he was just like, oh yeah, like if you can say it to another student with no problem, then you really know the concept, you really understand the material. So those little interactive learning sessions are great. We have a class called Clinical Correlates, which I kind of touched on a little bit earlier, but they basically will present a research article to you, and they will tell you in this research article, about something that you're learning in class, which is nice because it's a way for you to pass the material once more. So it's great to be able to sit in that class and actually do that. And it really helps you to solidify the knowledge as well. So that's the main goal of medical school, is to get through it and to understand and retain the information that they're giving to you. So those interactive learning classes really do help in that way. So the next question I have is, how have you found your fellow students in the sense of collaborating and things like that? So we talk all the time, not just people in my classes, people in upper meds, people in lower meds, and different things like that. We really sit and we're a family. So we say, hey, how you doing? How are classes? Do you need any help? Do you need a study tool? Like, what do you need? Because, we all want to make it. We all want to get to the end goal. And one way that we do that is by supporting one another and leaning on one another. And I think that's definitely something that we've kind of mastered over, the course of 3 semesters. Our class is very, very close, and we joke with each other, we laugh with each other, but we're also there to pick each other up when we need it. And that's ultimately, our relationship. And even upper meds, we get to know them and we build relationships with them. And it's great to know that if I have any questions, I know I can go over just across the way and ask, can you explain this to me? And, they're always willing to help, as long as it's not the day before tests, we're good. So another question that I have is, what do you do to relieve stress? So like I said, Nevis is a beautiful island. It's got green water. It's got see-through water. So snorkeling, going to the beach, just kind of relaxing on the beach, that's kind of my always go-to. I went to the beach this weekend just to put my feet in the water and sit out on a chair. It's a nice way to kind of take a moment, take a step back and have some me time, because you do have to take a break. You do have to, relax your mind and get the stress out for the most part. And that's definitely one way to do it. Another question talks about the sports and games and things like that. But speaking of that, we had a basketball game this past weekend. We had game night on Friday, which was really cool. And that was done by the Black Student Associations Club, and anybody can join it. So, but they had a game night. Uno was like lit. It was fun. And, they had a couple card games going on, spit was fun. So, we had a good time, especially Uno, like everybody gets into Uno. So it was definitely one that we could just laugh and kind of take a load off on. Organizations, there's student government around the school. There's, different clubs like the neurology club. There's AMSA. So we have all different kinds of clubs that you can definitely take part in and really enjoy. We have a Bible study club as well. And even more so, like there's a prayer room dedicated for Muslims that you can always go to pray. And that's important to a lot of my friends who are Muslim and who are Indian. So that's something that you can definitely find, kind of relaxing in. For me, I'm Christian, so we do have Bible study, and anybody's welcome to come. And, we pray for each other and really, make sure we keep, religion in our life as well here too. So another question is, okay, we talked about the group. So another question is about the mentor program. So I know a lot of people are like, how am I, I've gotten in and I'm coming here, and, what am I supposed to do about actually preparing to come here? It's scary to come to a whole nother island and a whole nother country, and you're getting visas, you're getting all kinds of stuff, and it's it's scary. I'm not even gonna lie. I was very nervous coming here, dropping everything in my life and moving to a whole nother country, and most of my family thought I was crazy, but nonetheless, here we are. But there's a mentor program here at MUA, and the thing about it is that you'll get a mentor coming into your Med 1 semester, and there's somebody who can tell you what to put in your suitcase. They're the ones who can tell you, it's kind of like, okay, well, these are the areas around the schools that you can live, or these are some areas that you can choose from, or, what should I bring? What should I be preparing for? Can you just give me insight on my Med 1 semester? Like, I'm scared. I'm so nervous. Like, what should I expect? It's the person that is there for you to just talk to and vent to. The thing about it is, once you get to Med 3, Med 4, you're kind of ready for, whatever the island has to throw at you, whatever the school has to throw at you. And we are a good vessel that they can use to kind of get that insight. So, if you are coming, make sure that you look into the mentors program and make sure that you're definitely included on that list. So that way you can have someone who you can talk to. And they're the best people that you can go to for advice, especially with packing, because it's nerve-wracking knowing what's on the island and what's not on the island. So we cover food in here. So, for women, there's hair products, there's all kinds of stuff that we bring. So, for the most part, you can rest with that. And I guess that's all of the questions that I actually have for you guys today that have been, pre-selected and things like that. If anybody has any more questions, you guys can reach out to the admissions office. Sarah's amazing. She helped me come in and, she really answered all 50 million questions that I had for her. But they're definitely there to help. And if you have any questions, do not hesitate to send them an email. I'm sure that, even if you put a message in the group, they will give you their contact information that you can, contact them for. And I just wanted to thank you guys so much for your time, and thank you for tuning in to the Facebook Live. And I hope to see you soon in the next coming couple semesters. I'm here for 2 more semesters, so I'd love to meet you, and I'd love to make you part of the family too. So thank you guys so much, and you guys have a wonderful day.